Foreign bodies are a relatively frequent condition, especially in hand and wrist. Despite this frequency, radiology has not paid enough attention to this condition. However, probably imaging is the best way for dealing with this problem, not only from the diagnostic, but also from the therapeutic point of view. The soft tissues in foreign bodies are of several natures, especially metallic, vegetal, and glass. They appear usually with symptoms like pain and swelling, and sometimes they can become infected. This is the reason why most of them are usually required to be removed. The removal, the dealing, diagnosis of this condition usually is made by direct exploration by usually by the surgeons or the orthopedist. The direct exploration of these foreign bodies is difficult by palpation because, in fact, most of the times they are beneath the skin and are not clear where they are. Radiology is usually required for dealing with this problem. The first technique used is usually radiography. The problem is that it is not very useful, especially in hand, because only radiopaque materials can be seen, and usually the bone hinders the visualization of this of most of this material. Ultrasound, however, detects any kind of foreign bodies, disregarding the nature of these foreign bodies, and the sensitivity and specificity of this technique is very, very high. Ultrasound has another benefit, is that it can be used to guide the removal of these foreign bodies. To perform ultrasound of foreign bodies, first of all, we need the high-frequency lineal proof. Hockey sticks proof are convenient, but are not necessary to dealing with this with foreign bodies. We need to explore the area in which the presence of a foreign body is suspected using transverse and longitudinal planes, and always look for possible associated complications. And finally, we need to consider the possibility of using ultrasound to guide the removal of these foreign bodies. Foreign bodies are usually echogenic. Depending the echogenicity, it depends on the material, the thickness, and the insonation angle of in which they are imaged. Frequently, we can see also shadowing behind they, especially in vegetal and metallic foreign bodies. Sometimes, especially in glass, can be seen another feature, that is reverberation behind the foreign bodies, and sometimes a small hypoechogenic halo can be seen behind surrounding these foreign bodies. The technique of removal starts first trying to detach the foreign body from the surrounding tissues. This can be done using the anesthetic, the local anesthetic, to produce this effect, injecting the anesthetic around with ultrasound guidance surrounding the foreign body to detach the foreign body from the tissues. Then a small incision is made in the skin that is going to be used to introduce to place the forces that are going to be used to remove the foreign body. Well, this is a video in which we can see a needle injecting anesthetic surrounding a vegetal foreign body in the hand. Then we can place the probe over the place where the foreign body is located, and using the incision we can place the forceps beneath the skin and guide them to grasp the foreign body, and allowing us to remove it. This is an image, not in the hand, in this case in the arm, in which we can see how the procedure is performed. We use in this case a hockey stick probe that are very, very convenient, as I said before, especially in the hands, because of the small size of the area in which we are removing the foreign body. This is a video in which we can see the small foreign body that is being grasped. You can see the jaws of the forceps that are grasping under sonographic guidance the foreign body to take it out of the hand. We use two different kinds of forceps, the Harman or alligator forceps and the Halsted or mosquito forceps. I recommend using a small Harman forceps because in this area the amount of tissue is more limited that they require for this long Harman. There are several types of Harman forceps. Any of them can be used in the hand with easy removal of the foreign bodies. Here we can see a small vegetal foreign body placed between both metacarpals, and here you can see the video in which we can see the forces going to the small piece of wood here, and this is the result. Another example, this is a vegetal foreign body, a palm spine, palm in the palm, in fact, and you can see the typical feature of the palm. And here we have a mosquito forceps that has been advanced until grasping the palm. We have used in this case a transverse approach. Transverse approach is recommended because of it's easy to perform the procedures this way. And finally, the result. This is a recent case in which we can see a fishbone here in a finger. Removing a foreign body in the finger is very, very difficult because we have very small amount of soft tissue, and the maneuver of the forceps in this area is quite difficult. And well, in this case, we use a transverse approach. You can see here, this is the fishbone here, and this is a Halsted and an alligator forceps that is grasping the fishbone. And here is the final result with the alligator forceps. If you want to know something more about this, and you can consult this recent publication by our group, which includes step-by-step procedure for US-guided foreign body removal in a part of the body. So, as a conclusion, remember that ultrasound is the best image technique for detecting superficial foreign bodies, especially in the hand. All types of foreign bodies can be imaged by ultrasound, disregarding the nature of the foreign body, and that ultrasound-guided extraction is the best therapeutic alternative for this kind of condition. Thank you very much.